Our next speaker is Parikh from DRiefcase. He is going to change the way health records are kept in hospitals.
Good evening, everyone. Thank you for the introduction. A quick question. Why do we like our family doctor? Simple. Because he knows us, what we are made up of, our past, the frequent colds, the kidney stones, the hospitalizations, the surgeries. Essentially, he knows our longitudinal health history. The power of this is immense. And that is why we launched Briefcase back in 2017. It was launched as a health record to capture your health history with the objective that over time, with the use of your longitudinal health history, we will make it better for you to access health services in a more efficient and possibly in a cheaper manner. Over the years, we faced several challenges. Inertia, everybody wanted a digital backup of their health history, but almost everybody did not want to do anything about it. The inertia was huge. But also, even from the provider side, the hospital, labs, the clinics, there was a certain degree of protectionism about sharing patient data, of course with patient consent, but there was a certain degree of protectionism that we faced. Tum mera data leke mera patient chura loge. Something we heard almost everywhere. Fast forward to 2021, when the government launched what is today known as the ABDM, the Ayushman Bharat Digital Mission. Essentially, India's public health digital good. A stack very similar to UPI, where UPI makes it easy for you to move your money from bank account A to bank account B. Now imagine the same if it were possible with your health information, your health data, to move from the server of one service provider, a hospital or a lab or a clinic where the data gets generated, to anybody who needs it, your insurance company, another doctor who's providing a second opinion, another doctor who's treating you basis something that had happened to you 3 years ago, wants access to your history. The use cases of this are immense. And the benefits, the consequences for the ecosystem as a whole, game changing. With the way the health locker would now start collecting longitudinal data under the ABDM, and this data can be used obviously not only for better care but also cheaper insurance, better pricing of insurance, wider coverage. It's simply put, the way healthcare will be delivered in this country is changing and changing rapidly. One of the use cases of the ABDM that is currently widely prevalent in public hospitals is that of the OPD registration, which is also popularly known as the scan and share. Just to elaborate on the problem statement very quickly, if you walk into any government hospital at 8 o'clock in the morning, you will see it is akin to a fish market and full of sick people. It takes about 3 or sometimes even longer, 3 hours or even longer, for someone to register himself at the OPD counter before he or she is directed to the actual doctor that she's supposed to go to for curing the problem. To solve for this, the NHA introduced the scan and share module, which creates a DigiYatra kind of a journey in a government hospital. So there is a separate queue. The patient walks in. He is encouraged to download an ABDM enabled PHR app and create his health ID, the ABHA, Ayushman Bharat Health account. They have to just scan a QR code, as a result of which the health ID relevant data from his Aadhaar gets transferred and the patient health card gets created automatically without having the patient to utter a word. He gets a token number, there's a separate queue, and what earlier took 3 to 4 hours is now taking minutes, literally minutes.
This is Kashiram Hospital in Kanpur, UP. Here, amidst the chaos, patients and their families navigate the labyrinth of healthcare services with long queues and indefinite wait times.
भूखे प्यासे सुबह के लाइन लगाए 2 बजे 12 बजे लाइन लगती थी। तो स्कूल छूट जाता था, पापा की दिक्कत होती थी।
बच्चों के साथ आते थे तो बच्चे भी परेशान होते थे, धूप बहुत तेज रहती थी।
While over 70% of our population, nearly a billion people, depend on public healthcare services, government expenditure on healthcare is under 30% of total expenses in most states.
अब एक पेशेंट हमारे यहाँ जैसे हॉस्पिटल में आया, एक तो पहले ही वो प्रॉब्लम में है जब वो आया, उसके बाद 2-2, 3-3 घंटे लाइन में लगा है, तो इससे उसको दिक्कत बहुत ज़्यादा होती थी, पेशेंट भी फ्रस्ट्रेट होता था। इसी चीज़ को दूर करने के लिए जैसे हमारे राष्ट्रीय स्वास्थ्य प्राधिकरण और आयुष्मान भारत डिजिटल मिशन की स्टेट टीम ने स्कैन एंड शेयर लॉन्च किया।
The scan and share system has been revolutionary in easing the registration process.
जब जो पेशेंट पहले 3 घंटा लाइन में लग रहा था, अब वो 5 मिनट में यहाँ से पर्चा बनवा के डॉक्टर के पास पहुँचेगा।
But we wanted to know how we could make it better and wanted to learn more about people's daily experiences with it. Hence, we decided to deploy Jan Ki Baat to hear from patients on the ground.
नमस्ते, ब्रीफकेस द्वारा आयोजित सर्वे में आपका स्वागत है।
जी नमस्ते।
जब आप काशीराम हॉस्पिटल गए थे, तो क्या आपने अपने आभा आईडी के साथ स्कैन एंड शेयर फीचर यूज किया था या आप नॉर्मल लाइन में खड़े थे?
जी मैंने स्कैनर यूज़ किया था।
क्या आपको नया स्कैन और शेयर रजिस्ट्रेशन प्रोसेस समझने में आसान लगा?
पहले तो समझ में नहीं आया, लेकिन स्टाफ मेंबर्स ने सपोर्ट किया, फिर कोई दिक्कत नहीं हुई।
JKB listens at scale, transforming voices into actionable insights. Using it, we surveyed over 100 people on their experience with the scan and share system.
The pilot survey that was conducted yielded 3 important findings. One was no surprise. It works. People love the fact that now they don't have to stand in these long queues, and in a matter of minutes, they actually end up saving half a day's salary in many cases. But there were other findings, which is something that we promised to take to work towards. The first one, in hospitals, several large government hospitals especially, the crowd, as I mentioned in the morning, is maddening. It often becomes difficult for the person to see beyond what is put in front of him. And therefore we realized that a lot of people, while they knew exactly what to do, create their Abha, scan the QR code, take the token, they did not know about the wider picture, what ABDM is all about, what Abha is all about, what the future entails. That education was being missed out upon. The other issue, the way this the way this is being currently implemented is there are Briefcase mitras or promoter boys essentially, who are present on the OPD floor guiding people towards how this is to be done. A lot of the registrations are happening effectively in an assistant mode. In the absence of the mitra, it was found that people found this a little unintuitive, and therefore we were wondering what could we do about it.
आज मैं आपकी क्या मदद कर सकता हूँ?
जब मैं पिछली बार हॉस्पिटल में आया था तो नर्स ने मुझे ये ऐप डाउनलोड करके आभा कार्ड बनाने को बोला था। ये आभा क्या होता है?
आभा का मतलब आयुष्मान भारत स्वास्थ्य खाता है। आइए इसके बारे में और जानें। मैं अपॉइंटमेंट बुक करने में आपकी मदद कर सकता हूँ। आप डॉक्टर को किस लिए मिलना चाहते हैं? अपनी समस्या बताएं।
मुझे 3 दिन से बहुत बुखार है और मेरे गले में भी काफी दर्द है।
मैंने आपकी समस्या नोट कर ली है। आप इनमें से किस डॉक्टर के पास जाना चाहते हैं? कस्तूरबा अस्पताल के डॉक्टर अनिरुद्ध जल्द से जल्द उपलब्ध हैं। आज शाम 5 बजे मैं आपके लिए स्लॉट बुक कर रहा हूँ।
Through the demo, we showcased how patients can book appointments in their natural languages from the comfort of their homes, all while streamlining the registration process for hospital administration using the scan and share system. But why stop there? When it comes to public healthcare, a lot more can be done. Accountability in public healthcare has always been a challenge. JKB can offer a direct line from hospital floors to health ministries. JKB brings visibility at scale, making feedback immediate and impactful. Imagine what this could unlock. And this is just the start.
In the past few decades, we have seen that where the voice of the people surpasses the usual escalation matrices, there is better adherence to compliance. What if feedback about public health infrastructure could reach the principal health secretary or the health minister directly from the floor of the hospital? They see a rat floating around, hospital staff are not coming on time, someone is asking for money which is supposed to be free, the pharmacies are not adequately stocked with medicines. If this feedback reaches the health secretary directly without going through the 4, 5, 6 levels of on an escalation matrix, the value that people would receive from the kind of expenditure our government makes on public health care is immense. We know, when people know that they are being watched, they are being accountable to the people, things happen. In India, we're going to take a few decades for our physical infrastructure to match what's there in the West at a national level. But technology can help hasten this. And Gen AI can actually hasten this even more. And simply put, why stop at scan and share? We showed you that the entire OPD registration process can be taken out of the picture just by having an AI engine write for patients to do this at the comfort of the house in their natural language. Just a start. Thank you.
Thank you very much, Harsh.